Okay, it is 1:33, so we're not going to wait any longer to hear this incredible presentation by Athena Actuarial and team. We've got Athena's leader, Adrian Lieberthal. We've got Paula Villafane and Lauren Holick here today, and they're going to talk about equity and total rewards and what that means to all of us as businesses and how we can make sure that we're taking an approach that makes sense for all of our stakeholders, not just the ones at the top. Before we get going today, I do want to mention that Athena is a partner of IE's. They've been a partner of ours from the very beginning. So please make sure that you check out their website, honor the work here that they're doing today. Please be interactive with them. And you know what? I'm going to turn it over and let the rest of you take it away. Thank you so much for being here. And I can't wait to learn more about everything that you have today.
Thank you. Thank you so much, Alyssa. And thanks so much for having us. I've been a huge fan of yours and of Insure Quality for the past few years. Really have loved watching IE take off and go the curvy path that our own company has gone. So it's been really exciting to do that alongside each other. I'm a little bit of background about Athena Actuarial Consulting. We are a woman-owned consulting firm focused on mitigating risk and identifying opportunity in the way that humans are cared for, compensated, benefited, and incentivized through actuarial services, data analytics, and people-centered strategies. So we primarily work with employers across the public and private sectors. We bring our technical expertise around modeling, analytics, and really predicting the future through our actuarial work to solve our clients' biggest problems, biggest challenges across benefits. And we get particularly excited when we have the opportunity to pair it with our values. So we come across a lot of employers these days who are looking just to check the box when it comes to compliance and regulatory requirements. But we're also seeing more and more employers, mission-driven employers, even government agencies who really are looking to move the needle on equitable treatment of all employees. So we're here today to share some of the big updates and changes across what we call total rewards, which includes all the ways that employees are compensated for their work, salary, and benefits, and to share some things that we think employees even themselves should be aware of. Our updates are both relevant to those of you who might be business owners interested in this topic as you map out your own rewards packages for employees, but also we're really on a mission to educate here and feel that the information we hold as consultants to employers should be accessible to employees as well. So Paula, if you can advance to the next slide. So Alyssa, the moment Alyssa has been waiting for with the ampersand. Speaking of exciting things, today's presentation is actually our formal unveiling of a new series that we're launching here at Athena called Equity and the Intersection of Equity and Everything. So in our work, we can't help it. We see the intersection of equity and everything we do. So as I mentioned before, we really feel like we're on this mission to bring this information to the public through speaking engagement, social media, articles, and collaborations with other like-minded professionals, which I assume is many of the people on this call. So this is the reason behind the ampersand. This is our new logo for our Equity and series. We're really excited about it. And we consider the topics today our first three stabs at shedding light on where we're seeing equity intersect with the topics that we work on in our day-to-day. So the first three intersections we plan to cover today are pay, retirement, and healthcare. There's so many elements of total rewards, including leave and PTO and disability insurance, and so many employer-sponsored programs that y'all probably interact with as insurance professionals as much as we do. We're excited to take Equity and on the road, virtually and in person, and explore all these intersections. It's even a challenge for us prepping for today to not go beyond the specific topics that we're focused on, but we're going to work hard to be really focused on the most pressing updates that we think employees and employers should be armed with as it relates to these three intersections of employer-sponsored benefit programs. So if you can advance the slides again, Paula. So I'm really excited to have, so these are the three topics that we're going to cover today. So our pay, retirement, and health. And so if you'll flip to the next slide, I'm really excited to have brought along two powerhouse women from Athena today, Lauren and Paula. And so we're gonna just introduce ourselves before we dive in. Lauren, do you wanna go ahead and go first?
Sure. Hi, everyone. Thanks for joining today. My name is Lauren Hollick. I'm based in Washington, D.C. I'm a manager at Athena, and I've been with the company since July of 2021, so just under 2 years here. I'm a data analytics professional and have been specializing in workforce analytics over the past few years. I'm really specifically passionate about looking at pay, hiring, retention, promotion strategies for different companies as it relates to their diversity, equity, and inclusion. I really love digging into the data and sort of identifying those discrepancies between demographic groups in those areas, and then collaborating with other DEI professionals who have some of those more qualitative soft skills and the background to really understand what the root causes are of any data discrepancies that we're seeing, and working to develop long-term solutions for equitable working environments. So that's kind of my background on why I'm passionate about this topic, and I'm really excited to be talking today. Paula, you want to go next?
Sure. Hi, everyone. I am Paula Villafane. I am a senior actuarial analyst and DEI strategy manager here at Athena. I have been working in the healthcare and benefits consulting space for 4 years now, joined Athena last summer in June. And the projects that I have supported in my career that excite me the most are those that have this exact intersection of healthcare consulting and diversity, equity, inclusion strategy. So it's been really great to be able to collaborate with clients to create a benefits package that is mindful of the context of their population, similar to what Lauren just mentioned. When it comes to health, consulting actuaries take more of a short-term view and are able to support clients with implementing program changes, communicating these changes with the employees, and assessing the year-over-year impact of their decisions on their population's health. So we, the actuaries and the clients, share that common goal to better understand what the gaps in health status between the demographic groups of an employee population are, and work together to propose solutions to support the specific needs of their employees. So yeah, it's really great to be here with you all today and continue the conversation. And I'll hand it back to Adrienne.
Awesome. Thanks, Paula and Lauren. I'm Adrienne Lieberthal. Ostroff was my maiden name. I'm going through the painful process of changing my name right now. I am the CEO and founder of Athena Actuarial Consulting. I am sitting here in our Minneapolis headquarters in downtown Minneapolis. I personally am a pension actuary by trade, and I think I get very excited about, again, the intersection of equity and any kind of rewards, but specifically retirement as a nerdy pension actuary, because I think there's so much that pension actuaries can do with our professional skill sets to move the needle on equity. There's really the education element and shedding light on a benefit that's often misunderstood or even misconstrued to the public or mismanaged. But also actuaries are trained to do long-term projections. That's what pension actuaries really specialize in. And it's in the long term that we're seeing the inequities, the wealth gap, and other inequities exacerbated. So in all my free time, I am on the Retirement Plan Experience Committee with the Society of Actuaries, which is a task force that studies and pushes out mortality tables and improvement scales for actuaries to use across the US to base their projections. I frequently speak about the impact of COVID-19 on long-term mortality, which is a big unknown, big question mark at this point. But what we do know is that it varies widely based on socioeconomic status and race, and that the pandemic has shined a very targeted light on age-old systemic problems. So I am personally determined not to let this opportunity to press on these conversations pass by, and hence equity and being born. So I am going to pass it off to Lauren. I think if we move ahead to jump in on our first topic.
Awesome. Thanks, Adrienne. So the first topic of the three that we're going to talk about today is equity and pay. So Paul, if you could go to the next slide. So just starting off with a definition here. So Pay equity is the practice of providing equal pay to individuals performing in similar job positions under similar circumstances, regardless of their race, ethnicity, gender, or sexual orientation. So of course, there are some legitimate factors that would be the cause of differences in pay for how an employer sets up their pay structure. Examples would be tenure, role within an organization, credentials, and work experience. Pay inequities really arise when all of those legitimate factors for differences in pay have been controlled for, and you're still noticing a trend that demonstrates differences in pay amongst individuals based on demographic groups. Another important thing to note is most companies and employers who are exhibiting trends in pay inequity did not get there intentionally. It really takes awareness and consistent measurement on the employer side to identify these pay inequities and remediate the underlying causes and issues that are causing these pay inequities in order to support the systemic change in an equitable pay environment. Next slide. So I wanted to talk today through a couple of items in pay equity legislation. So there's several different federal and state laws and agencies whose sole purpose is to protect against pay inequities. The first one on the slide here is the Equal Employment Opportunity Commission. The EEOC is a federal agency that is specifically designed to administer and enforce civil rights laws against workplace discrimination. Equal pay is a national enforcement priority for the EEOC. Over the past few years and more recently, there's been new legislative and regulatory developments at both the federal and the state and local levels, which have been motivated by a desire to create a more favorable environment for the discriminated employees in equal pay legislation and litigation. So like it says on the top of the screen there, the burden of proof has really been shifted to the employer when it comes to claims of pay inequity. And the EEOC is there specifically to help individuals who feel as though they have a discriminatory employment situation. In addition to the EEOC as a federal agency, there's two primary federal laws that employees and employers should be aware of regarding pay equity. The first is the Equal Pay Act of 1963, and the second is Title VII of the Civil Rights Act of 1964. So the Equal Pay Act of 1963 specifically prohibits employers from paying men and women different wages if they work in the same establishment, perform the same jobs that require substantially equal skill, effort, and responsibility under similar working conditions. So in order for employees to win an EPA claim, they don't have to prove that employers intended to discriminate. I think that's a really important point. And like I said on the previous slide, a lot of employers don't realize that they have inequitable pay. To win an EPA claim, you don't need to prove that they intended this. All you need to prove is the existence of pay disparity. And unless the employer can prove that disparity is a result of certain non-discriminatory practices, then an employee could win that EPA claim. In terms of non-discriminatory practices, there are 4 defenses that employers can use to contest an otherwise valid EPA claim. So those, in other words, would be like what I said on that first slide, the reasons that pay would differ that's different than demographic groups. And so the 4 that are listed in the EPA are a seniority system, a merit system, a system that measures earnings by quantity or quality of production, and then finally, any factor other than sex. So that 4th bucket has proven pretty controversial in terms of recent litigation because it's really a catch-all bucket to say that you're paying someone equitably on a factor other than sex without actually proving what that factor is. So I think in the coming years, it'll be interesting to see kind of how legislation and different claims are opined on based on that 4th bucket of any factor other than sex. So with EPA, we're talking a lot about men being paid differently than women. For Title VII of the Civil Rights Act of 1964, that addresses a lot more different forms of discrimination. Specifically, Title VII prohibits employment discrimination based on race, color, religion, sex, and national origin. In addition to those topics, based on a 2020 Supreme Court decision, Title VII now has protections that also apply to discrimination based on sexual orientation and transgender status. Although this hasn't been opined on yet, it's anticipated that the status of non-binary employees under both Title VII and EPA will almost certainly be discussed and litigated on in the foreseeable future as well. So there's a few differences between Title VII and EPA, both for what's required for trial, as well as what employees might be entitled to recover. So both allow for recovery of lost wages. For the context of the EPA, it's the difference between the discriminated employee's compensation and that of the similar employee that's identified within the claim. In the case of Title VII, employees not only recover those lost wages if they win their trial, but they can also recover monetary damages for pain and suffering, as well as emotional distress. And then both EPA and Title VII allow for successful employees to recover attorney fees. The last item on this page for pay equity legislation is the state equal pay and pay transparency laws. So employers and employees are also subject to state and local laws where they operate or reside. Each of these laws offer varying degrees of protection for the employees and employers. The landscape around pay equity and pay transparency laws also varies significantly for each of the 50 US states. So it's really important to know the laws for the specific state that your business is operating under or that you as an employer are residing in. Next slide. So I'd also like to highlight two recent examples of cases where the EEOC specifically has helped employees win in cases of pay discrimination against their employers. So the first is in 2021, the EEOC announced that two hospitality companies had agreed to pay $400,000 to settle an equal pay lawsuit. This was a lawsuit in which a male employee was being paid significantly more than two female employees who were doing substantially similar work to that male employee. Not only did the companies have to pay the settlement, they were also required to do a number of other things, including conducting periodic training on pay discrimination, maintaining anti-discrimination policies and records, posting anti-discrimination notices, and providing periodic reports to the EEOC. Finally, they also had to retain an economist to conduct periodic pay equity studies. Another similar case, in September of 2021, the EEOC announced that Dell had agreed to settle in an equal pay lawsuit by paying $75,000, again to a female employee who was paid less than their male counterpart. They also had to provide specialized training on the EPA and Title VII and report certain information to the EEOC regarding employee reports of discrimination. So those are two small examples where not only did the company have to pay those settlement fees, but they also had to put in place certain policies and trainings in order to inform their employees of their equal pay rights. Next slide. So kind of wrapping up this equity and pay section before we move on to the equity and retirement, there are just three things that I really want you all to take away from everything that I just talked about with the different legislation and what pay equity really means. And the first truly is that the burden of proof is shifting from employee to employer. So all these recent rulings and legislations at both the state and local level and federal level is putting the onus on the employers to not only prove that they're paying equitably, but continually monitoring that their compensation structure is set up in an equitable manner and that they've got policies and trainings in place for their employees. This has become even more important during the Great Resignation, which was brought on by COVID when people were choosing to leave their employers. Companies were really needing to demonstrate that they value all of their employees in order to attract and retain top talent, and paying equitably is just one piece of that. Another thing is understanding your federal, state, and local rights as both an employee and an employer. It's really important to look at those different laws that I just described and the recent legislation that uses those laws to understand both from an employee's perspective what your rights are as well as an employer. And then finally, to really know where to go if you do believe that you have a case for pay discrimination. If any of the things that I brought up today make you believe that you or someone you know have a discriminatory employment situation, you should really feel empowered to seek the legal counsel as soon as possible to discuss your options. And the EEOC website is a great place to start for that. They've got a lot of information on both what constitutes a pay compensation discrimination, as well as information for filing that discrimination charge. So with that, I'm going to pass it over to Adrienne to discuss equity and retirement.
Thank you, Lauren. And I see a couple things coming through the chat. We're going to get to all the questions. We've set aside time at the end for Q&A because we know we could talk about this stuff all day, but thank you everyone for submitting some questions. Yeah, it's a very interesting time, especially on how the pay equity and benefit equity landscape is shifting. Not just in that there's risk for an employer if they were to be determined to be benefiting or paying inequitably, but talent doesn't want to just know that they're being paid equitably. They want to know that they work for an organization that's paying everybody that equitably. So I think that's a generational shift. It's just a workforce shift, mindset shift, not just that I'm being taken care of, but my employer cares so much they're taking care of everybody. So I think that applies across all three of these topics, but I think that retirement's definitely a tricky one because it's something that isn't top of mind until it is. So it's a really interesting benefit in that it can be more complex. It can be really far away, but I think that as we start to study some things around retirement outcomes and retirement income adequacy, we're seeing a big wealth gap between genders, between socioeconomic status, and really in the United States, retirement is a privilege. Much to my dismay as a pension actuary, the days of traditional pensions in the private sector are pretty limited. And there's a shift from a traditional defined benefit pension plan where you work your 30 years and you from the same organization and then you retire, to this defined contribution plan for good reason in some cases. Things like 401ks, they're more portable. When we saw the workforce moving organizations every couple of years, this was a reaction to that in a lot of ways. But what it does is it shifts the risk and burden of planning for retirement from your employer's job to yours as an employee. And in the US, our system is really built on the premise that retirement savings happens primarily through your employer-sponsored retirement plan or your own financial planning. We could do a whole session on those flaws inherent in that approach, including the insufficiencies of Social Security, and especially as we move forward in the next generation and the one after that. And similar to the comments Paula probably would love to talk about public healthcare versus employer-sponsored healthcare. But today I'm going to really focus on employer-sponsored retirement plans. What's changed? What you should know as a potential participant in these plans, and really, or as an employer, based on the work we're doing to support employers with these requirements. So if you shift, thanks, Paula. So how do we define equity in retirement? Really, it's this level playing field. You can't force someone to save their own money, but you can withhold the opportunity for them to do so in a tax effective way, in a way that really maximizes the compounding effect of interest, and whether that's intentionally or unintentionally. You can both create or withhold the opportunity from certain groups to have this to have the accessibility to save for their own retirement. So the big change in the retirement landscape, if you flip the slide, Paula, is this Secure 2.0 Act. So this was included as part of the Consolidated Appropriations Act, which was passed December 23rd, 2022 and signed into law a couple of days later. So this provided an overhaul of retirement legislation. In a lot of cases, the goal was to ensure that all employees have equal opportunity to participate in and benefit from their employer's retirement plan. So there was heavy focus on those pockets of people who are missing out, those who are employed by small business, those who are not benefiting from the way the legislation had stood before this overhaul. So some of the things that I think are really good to know, really some really cool features of Secure 2.0. But the first, expanding access to retirement plans. So Secure 2.0 does require more employers to offer retirement plans to their employees, and then it also just offers incentives for them to do so, especially small business. So for all businesses, it's something interesting that automatic enrollment and auto escalation have been around for a while, where your employer, they could have a provision in their plan where when you started your job, you could, if you did nothing, you were automatically put into the 401k, and each year your contribution was increased by 1%. But starting January 1st, 2025, actually all new 401k plans are required to automatically enroll new employees in their plan at an initial amount between 3 and 10%, with auto escalation at 1% per year until they hit between 10 and 15%. It's really interesting. It's basically trying to take advantage of the psychological, you don't miss something that you didn't really notice was gone, and slowly help employees get into the mindset of saving for their retirement. And really something that we see a lot is people assuming that if they save to the match, that's adequate, and it is usually not. So really encouraging people to save above even what their employer is matching. Employees can opt out, but they have to take action if they want to do that. And usually inaction is easier than taking action. Where in this case, it'll just, if you do nothing, you'll be enrolled in these plans. In addition, I think a really cool feature, expanding access for those who have had or have student loan debt. You're oftentimes faced with the decision of whether to leave money on the table with your employer's 401k match or pay down your debt. And in a lot of cases, that debt might be pretty high interest. Financially, it does make sense to pay the debt down instead of putting to your retirement. Well, under this Secure 2.0, effective 2024, employers can contribute a matching contribution to your retirement plan based on your payment to your student loan debt. So I think that's really cool because it's they're not leaving that, if there's a 3 or a 5% match, if they put 3 or 5% of their pay against their student loan debt, they're able to get some money put aside for their retirement. It's better than just missing out basically on that benefit your employer has set aside for you. So I think that's a really cool feature. The next is increasing availability of retirement savings options. There's new types of retirement saving accounts that have just been introduced: universal savings accounts, USAs, and automatic retirement plans, which provide more flexible and accessible savings options. The point is things that are mobility, portability, being able to move them between employers, but also helping employers where the burden of setting up the plan may have been cost prohibitive, or just the compliance may have been expensive or challenging to navigate. There's some new changes to these rules that make them more accessible for smaller businesses. Providing better retirement benefits for low-income workers. This is something that did exist before, but it wasn't as widely known or used. It's a tax credit that's available for low-income savers to provide, and now there's a new tax credit for the employers offering the retirement plans to those low-income savers. So I think that's something that they're hoping that if it's a little bit more, if the tax credit's a little higher, maybe it'll boost some utilization. But I think it's up to companies like ours who might be working with an employer to advertise to those low-income savers that they should be able to take advantage of this. There was a lot of thought put into improving retirement security for women and caregivers, providing caregiver credits specifically to help individuals who took time out of the workforce to care for family members, and to allow for spousal IRA contributions for the non-working spouses. So if somebody is a stay-at-home caregiver, there's more flexibility to be able to maximize on behalf of the working spouse. And then last, there was some strengthening of Social Security, which is the kind of ever-evolving problem in retirement. And I think So Secure 2.0 does increase the Social Security benefits, but they're really, I mean, they're trying to allocate limited resources. We know there's not going to be enough for all individuals and all future generations, unless some of these innovative think tanks that are ongoing come up with something that's not been seen. But the key is that they're increasing the benefits for low income workers who are least likely to have their own savings and or access to employer savings, employer provided benefits. So providing a minimum benefit, there's a minimum benefit for workers who've worked at least 30 years, really honoring long tenured employees who've paid their taxes into the system. And it reduces the taxation of Social Security benefits for seniors. So overall, Secure 2.0, it's really exciting in the retirement space. We do a lot of work with the public sector, so it's a little bit less in our day-to-day of clients that are impacted, but it's really exciting, at least to see this direction and kind of a renewed emphasis on retirement, especially as the boomer generation is approaching that age. We're going to see a lot of people entering retirement, those who can afford to. So I think it's really cool to see a lot of the legislation is specifically targeting groups who've been left behind in the past with opportunities to save. So if we move on to a real life example here, something we aim to do at Athena with our client work is really humanize the information that we push out there, both if it's in our marketing or our proposals or in our client work. So Lauren, talked about some real stories on the impact of pay equity on real people. For my real life example, I'm going to focus on a very anonymized story from some of our work. We do actually serve as an expert witness on discrimination cases for those who are suing their employer for pay discrimination. We support a few different law firms in this work and work to defend individuals who've been the victim of discrimination in the workplace. One case that we supported recently, it was really interesting because there actually was a pay equity study that was performed. So to answer a question I saw floating that we'll go into more later, the first step is to do a pay equity study to understand where you're at. But I think that choosing the right firm to work with and the right type of professional to do that study is really important. In this case, the way this employer compensated was heavy on the benefits, and the benefits were excluded from the study. So the individual saw that the study that they presented to all their employees, because there had been some rumors of pay inequity and some kind of upset, disgruntled employees. The individual that ended up pursuing action felt something was off and really requested more information from the underlying data about the study and about the fact that benefits were excluded when they're very, very valuable for this workforce. They actually had been employed for a pretty long tenure and happened to start work at a very similar time as their spouse, who was of a different gender. And they'd worked in similar roles, though had very different terms of employment. So in addition to some very blatant comments that were happened to be captured via email, unfortunately for that employer, the individual was really aware of all the benefit programs that they should have had access to and didn't because of their spouse. So it's really interesting because while there's the EEOC and there's entities out there that are supposed to be enforcing pay equity, it can be challenging to show that you were doing the same job and you should have had the same pay or more, you were more qualified. But in this case, there was a specific person to compare against. And so we see a lot of advancements in the law around pay equity for the same job. But in this case, a lot of the inequity fell actually down to the benefits and the lack of opportunity. So career equity, which is kind of a buzzword right now. So not everybody has this exact situation to compare against. Plus, I think in this case, a pay equity study actually kind of hurt the case because the employer felt as though they've proven we're paying equitably. But it had been, in our professional opinion, a bit distorted. So I think it's really important if you're an employer really trying to do right by your workforce to vet who you're working with. But there can be bias both directions. Obviously, we really love to support the little guy or gal that is. So I think that we feel that our values and our technical expertise make us particularly well suited to doing these studies. But I think that in anything where somebody can make money, there may be some bad actors. So in this situation, I think though the takeaway is that it required for this individual, nobody was going to hand it to her, though I think the employer did actually proactively reach out to remediate. In this case, she armed herself with data, with knowledge of what was out there to protect her, and at the end of the day, had to get to a point where kind of so fed up that she no longer feared losing her job, which unfortunately is as usually comes with a settlement in this case, some form or another. So I think that it's not necessarily a happy ending to the story, but it was something that we're really excited to be able to be in the position to support, given that benefits can be, again, misconstrued, miscommunicated, misunderstood, and they hold a ton of value. And from the employer's perspective, they're really an opportunity for them to customize the experience to the employees and what they need to thrive for all employees. So if we go to the next slide, I'll leave you with my 3 takeaways. So 1, know what you're owed. Ask your HR department for the plan document, or if you are the employer, make sure that your HR department is ready to talk about these benefits. And you can always ask for what's called a plan document or a summary plan description. Taking advantage of public resources to help you interpret what you're owed when it comes to pension, retirement, if you do have those offerings. There's actually the American Academy of Actuaries has a volunteer program. If you go on their website, one of our employees participates in this. They volunteer with it, where you can give free guidance to people around the interpretation of their pension. So just can talk to a pension actuary who's geeking out about talking about what they love talking about. And there's also a ton of Secure 2.0 summaries out there that are tailored to all the different people who benefited, both employees, employers. We're always happy to help interpret the Secure 2.0 provisions as well. Understand how recent changes may impact you. So whether your employer is supplementing your retirement or not, I think the general shift in retirement is that people are really on their own to set themselves up, hopefully getting some help from their employer, some help from Social Security. It'll be there. It'll just be at a lesser and lesser amount over the years. But I think that it'll be on each individual person to make sure that they're understanding what changes, what opportunities there are out there to take advantage of. And then there's nothing a pension actuary loves more than demonstrating the power of compounding interest. So contributing early and often is key. Another key provision I love in Secure 2.0 is that $1,000 a year can be pulled out without paying the excise tax for emergencies. And there's also this other sidecar option, which with another $2,500 provision. I think that some of the hurdle for people mentally and contributing early is, what if I need to grab it? What if I need $1,000 for something went in my house? Or I think especially with COVID, when people, maybe there was a layoff or they just needed to access that cash, there was an emergency provision that was passed, and then it was actually solidified in Secure 2.0 that there are ways to get it if you need to touch that cash without being really punished by that excise tax. And I think that hopefully helps with the hurdle of contributing early, because it's not that it's gone for the next 10, 20, 30 years. So with that, equity and retirement, really excited to get to the Q&A, but first I'm going to pass it off to Paula.
Thanks, Adrienne. And I'm going to jump right into the health section to make sure we have time at the end for questions. So the CDC defines health equity as the state in which everyone has fair and just opportunity to attain their highest level of health. And we can't really discuss health equity without also defining social determinants of health. So social determinants of health are non-medical factors that create health inequities and heavily influence health disparities between populations. Only about 20% of an individual's health outcome is tied to clinical care, with the remaining 80% being health behaviors such as tobacco use and diet, socioeconomic factors such as education and employment, and the physical environment. So you can think of air quality and housing as examples for those. So by recognizing the different conditions in which people are born, raised, work, live, and grow, health plan sponsors can make better decisions in creating the benefits program to improve the overall health outcomes of their population. Like Adrian mentioned, we can do a whole other presentation just to speak to the differences between employer-sponsored program and what advantages they have over federal and state programs like Medicare and Medicaid. But for the purposes of this presentation, we will be focusing on the employer-sponsored programs. So the way that we define equity in health benefits is by the strategy that drives the decisions between the cost sharing, the health plan administrators, wellness initiatives, provider network, plan design, and communications with an employer's population. An equitable health benefit design ensures that policyholders understand their benefits and have access to affordable health care that addresses their individualized needs and the social determinants of health pertinent to their population. So we have witnessed a series of changes in the healthcare regulatory landscape over the last couple of decades. Many of the changes intended to protect people from health risks and associated financial risks. Of these legislative changes, I'd say the Patient Protection and Affordable Care Act, also known as the ACA, is one of the most common, most recognizable, largely because it made some of the biggest waves in protecting consumers and making health coverage easier to understand. So there's a lot that the ACA did, but I'm just going to go through 3 highlights. Number 1, as a result of the ACA, most health plans are required to cover a set of preventive services at no cost to policyholder, as long as the provider is in network. So this removes the financial risk of needing to hit your deductible or paying co-pays to seek care. And it really encourages regular check-ins with your primary care provider to monitor general health and identify some of your risk factors. Number 2, the ACA also requires insurance companies and employer-sponsored health plans to provide policyholders with a summary of benefits and coverage and a glossary of terms used in the health documents. So this makes it easier to compare covered services between plans and understand what the cost that you will be on the line for between different plans. And it helps consumers make those informed decisions of, which plan do I want to opt into? How much am I willing to pay for each service? And number 3, employer-sponsored plans are no longer able to reject you, charge you more, or impose a waiting period for pre-existing conditions under the ACA. Because we know that health disparities exist in chronic illness rates between different populations, which is largely driven by the social determinants of health, this change helps protect employees' access to care. So beyond the Affordable Care Act, the No Surprises Act, which went into effect January 1st of 2022, protects people from medical debt resulting from emergency services provided by out-of-network providers. So in the moment of an accident, people really shouldn't have to worry about whether or not the closest healthcare provider or facility is in network. And unfortunately, more than half of Americans are not able to cover a $1,000 emergency expense, which we know medical expenses can easily add up to this and more. The No Surprises Act addresses some of the affordability aspect of healthcare equity by lessening the financial hardship in cases of emergencies. And there's also other legislative requirements, such as the non-discrimination testing on employer-provided benefit plans that determine if benefits like healthcare flexible spending accounts and dependent care flexible spending accounts unjustly favor higher paid individuals or those key employees who are in charge in an organization. So this is an IRS requirement that makes sure that employees have equal access to the plans offered by their company, and it supports financial equity in the workplace. So as healthcare actuaries, we need to have a really good sense of the legal landscape as we're advising on the benefit plans. We also need to be prepared to react to new ideas that might challenge the current regulatory environment. So these compliance elements illustrate that there are mechanisms in place to guide employers who sponsor health plans towards an equitable benefits program. There's still ways for individuals to advocate for themselves and request the care that they need if they do see health inequities that their employers are not addressing. So to speak to a real life example, during a benefits audit project that I worked on, which looks through health plan offerings from a diversity, equity, and inclusion perspective, the benefits manager on the client team shared feedback from an employee resource group requesting to extend coverage of MRIs as a covered preventive service to screen for breast cancer in people with dense breast tissue. Almost half of women who are at the age of 40 and older have dense breast tissue, which makes mammograms harder to interpret, increasing the risk of breast cancer. And while a provider might follow up and say, the mammogram is inconclusive, maybe an MRI is a good idea, suggest this to people with dense breast tissue, the people who are receiving the treatment might be reluctant to accept the follow-up procedure due to the high costs associated with MRIs, or just the lack of education of how MRIs could be beneficial. So this example highlights a specific demographic of people, in this case, women over the age of 40, who are more likely to be at risk of developing a health disease, cancer, due to their sex and age. And ultimately, in this example, the U.S. Preventive Services Task Force is the one who makes the recommendation to employers of what services should be covered as preventive. But by raising this concern to the benefits manager at her organization, it led to the benefits manager, the consultants on the team, to work with a third-party administrator to suggest what are some program changes that we can make to the plan to better support employees who share the same risk. So I know this is a lot of information I just tried quickly going through, but to summarize 3 recommendations that I would suggest for those of you listening. Number 1, become familiar with what is and what is not covered under your health plan. You can always provide feedback to your employer if your plan has any limitations or restrictions to the benefits that you need to support your own health. Like I mentioned before, the plan sponsors are required to have a summary of benefits and coverage for your health plan and for alternative health plans that are available to you, so you can have a side-by-side in layman's term of what this text means. Number 2, choose a plan that supports your health and your financial risks. Plans have cost-sharing mechanisms like premiums, deductibles, co-insurances, co-pays, etc. This gives people an estimate of how much they can expect to be on the line for paying for each service. Always make sure to double check if a provider you need is in or out of network, since the cost sharing mechanisms may differ. But the No Surprises Act will protect you from some of these costs in emergencies and for a few non-emergency services as well. And number 3, do not miss out on zero cost preventive services. Thanks to the Affordable Care Act, there are many office visits that are considered preventive and are covered regardless of any cost sharing limitations of the plan. So that means as long as you have coverage under a health plan, services like your annual physical exam, hearing screenings, immunizations, etc., are provided to you at no cost, aside from any applicable premiums. And this really, tries to nip it in the bud early, identify those risk factors, so that in the long run, you're not facing, extreme medical bills, and you can try to manage those early. So that brings me to the end of the equity and health section, and I'll flip it back over to Adrienne.
Yeah, thanks, Paula, and thanks everybody for joining today and dropping some questions in. So I think we can take some Q&A now. We'll run through right up into the top of our time here. We also love talking about equity, benefits, or both. So if you'd like to continue the conversation, I think Alyssa's going to send out information about, or email info@athenaactuarial.com, or even the book a meeting link for myself. So can always reach out afterwards if we don't get to your questions today.
Adrienne, I love that. And yes, we will be sending an email so that you can get in touch with Adrienne and team I love the ampersand and everything that you put out there. And it is still Women's History Month. We're closing it out with 3 incredible women, but remember that all of these topics affect us at different levels of intersection. And thank you so much for calling that out. Before you hop into Q&A, just in case people have to run, would you mind telling people, I know you said you could interact with the website and info at athenaactuarial.com, but could you give them a quick overview of some of the things that you do, so that way they know if they're a decision maker at their employer or have the ear of a decision maker at their employer, that they could, thank you, look at that. It's like, it's like you're professionals or something. Would you mind sharing some of that?
Yeah, we do a wide range of things that range from more traditional actuarial services. For us, it's valuation work, reserving. We will support larger self-insured organizations in the healthcare and retirement space. But I think some of the work that we're getting really excited about is more on the strategic side, workforce analytics, data visualization, trying to identify inequities at all points of the organization, and really being the specialists in measurement. Like Lauren said, we actually team up with we have a lot of teaming partners, a lot of women-owned businesses that we love teaming up with. So if you have any complementing services, that's a good time to reach out. Where we'll be the kind of the back end doing the measurement, revealing the KPIs. I saw a question on that are maybe inferring that there is a problem, and then we'll team up with the specialist either in that industry or in that service to really dive in and get to the bottom of it and help the organization through the change. So we're really the measurement people, the data nerds. So anything that falls on that spectrum of traditional actuarial services supporting the back end, or even on the measurement and reporting of claims and other types of things that might benefit from data visualization, all the way to the really just managing the risks and opportunities within your workforce, and the way that the things may be intentionally or unintentionally impacting the future of that workforce.
Amazing. Would it be helpful if I read a couple of these questions for you?
Sure.
Let's do it. I'm going to skip to Andrea's first because it's not mine. As the burden of proof shifts, how can professionals use this information when looking for jobs or asking for a pay change? So what's a reasonable or practical action step?
Pay transparency. Know the laws where you're applying for jobs. It's not just coming, it's here. So I think a really big, we have a report that kind of goes state by state with pay transparency laws. It actually was we pushed it out last year, and even since then, there's new laws that have been passed through. One of the earliest and most notable was New York City. So even it can vary based on the local municipality. If you're applying for a job and there's a pay transparency law, they're required to disclose the compensation range. And if they're not disclosing that range, ask about it. It can be tough because you want to navigate wanting that job with like pissing off their HR person. But at the end of the day, they're required to be transparent with the pay range. The point is that a lot of inequities start on day one with the individual not really knowing what to ask for. And so the pay transparency laws will require that the range be disclosed. Also, there are some places that protect against the employer asking you what your prior pay was. So really using the things that you brought to the table through what should be a more comprehensive application process on factors that truly indicate the value to, whether it's their client, their customers, or the way that they make money as an organization, and not the factors that Lauren had emphasized as discriminatory. So I think that knowing the pay transparency laws and making sure that that you're asking about them, kind of even just if you're involved in the recruiting process, asking, what's the pay range for our listing? Because if you're recruiting virtually and you have someone from New York City or one of the states that requires it applies to you. Like, you have to be transparent on your pay range. I think also as an employee, you can ask your employer for their most recent pay equity study. Those aren't always required. But I think that, especially around raise time, you could ask them what was done in the comp setting process to account for equal pay laws or account for pay equity. It's not that you're, I think, prior to all these laws, if you asked questions like that and it kind of scared the employer into thinking they were going to have a discriminatory claim against them, these days I think it's becoming table stakes. So the expectation is that they did some form of reviewing to make sure that there's equal pay for equal jobs for people in different roles.
Amazing. And just so everybody knows, if you go to the website ensureequality.org, on our resources page, we do have the listing for each state for EEOC. So if you need more information on your state, please go there. But I think, Adrian, you teed us up very nicely into another question, because something that we hear a lot are that employers are scared of the litigation that could occur. And even in one of your examples, there was somebody that they had already done a pay equity study and it still happened. So what should employers be doing right now? And I know that you're not a lawyer and you can't give us all advice, but what should employers be doing right now when they discover an inequity?
So I think the key with Lauren's point on how the burden of proof has shifted from employee to employer, it means that they can't just say, oh, I didn't know. Like they have to prove that they went all the way and determined that there wasn't inequities, or if there were, that they remediated them. So I think if an employer discovers an inequity, the first thing they need to do is a study to identify who else was impacted. Because if you noticed one person, or you have one person who comes forward and says, I talked to this person who sits next to me at work, we do the same job, they're being paid different from me, tell me why. If they get that complaint, that's usually where it starts, it's having the conversation with that individual and working through a way as the employer to try to remediate the issue. While the first step after a pay equity study is usually to adjust pay, or if you're in raise time, to make sure that people are paid equitably prospectively. But there's a whole communication element. I know of people who've gotten an equity adjustment from their employer, and they're like, well, what about all the years that I didn't have the same pay for the same job? So I think communication, some sort of lump sum that accounts for the inequity, working collaboratively, employer, employee, and really trying to use it as an opportunity to build trust and say, hey, we're trying to do the right thing. I think that the changing legal landscape means that, like, doing nothing and playing dumb you're going to be in more trouble than if you work collaboratively with that employee. I'm sure legal probably has different perspectives depending on the organization, but in the case of one of our clients, their HR department did actually proactively seek to remediate. I don't know if it's going to help them, but it certainly is going to help them avoid an EEOC claim, because they're going to resolve it without it going to that point.
Amazing. And I know that we're right at time, but if you have time for one more question, I know this is one that everybody gets. Oh, hold on. We have potentially one more. Oh, Salesforce is a good case study. Yes, Lori, thank you. KPIs. This is a big one for everybody. And if we're not measuring it, then we don't know what's going on. Do you have any KPIs that you recommend?
Yes, so I think that we actually have a scorecard that we use in our pay equity studies, because when we get to the bottom of that, I mean, KPIs, it's just indicating something that's underneath. It's just the surface. So even in our pay equity study, we wanted to have metrics that are beyond just pay equity. But the big ones that I think to watch in terms of equity in the workplace, I would tie to the three that we have, that we push out regularly. There's pay equity, which you need to do a study and like an analysis to determine if there's differences in pay that are material. They should be immaterial when compared across gender or race, ethnicity, sexual orientation. But if you think about that, the only way you're going to study that is by collecting that information. So I think the first thing is starting with, how are you collecting the demographic information, especially because some things are required by EEOC, but things like sexual orientation may not be. So you're not going to know if you have a discriminatory situation, a systemic problem, if you're not collecting it. So I think first is starting with inclusive options. When you're asking people to submit information, the first way to turn them off is if they don't feel like they fit in any of your boxes. So I think that's first. Checking if people are inputting the data. If they're not, they probably don't trust you as an employer and how you're going to use it. So working to build the trust to have the data integrity in those fields to be able to move to the next phase. But data collection, having KPIs around that, what percentage of employees are inputting this info? What can we glean from that if they're not? And then last is diverse representation, slicing it many different ways. If you just look across the whole company, you're going to really you're not going to be able to see those underlying issues. It's looking at the representation at different levels, because what we're seeing is as you go higher up, then people are falling off the ladder. So I think data collection, metrics, diverse representation, and slicing it by level, and then you're able to really do effective pay equity studies and prove that you have parity. But really, just like any KPI, they're just the outputs, the indicators of if you are or aren't on the right track. So from there, anytime you dive in to get specific on that organization, and figuring out where there might be issues, you have to really ask the right questions and figure out what's the cause of your systemic issues that are so embedded in your culture, they probably are not coming through on the surface. So every organization is different, but there's some themes across industries and employers that we do see.
Adrienne, Paula, Lauren, this was incredible, super informative. I learned so much. I'm so excited for the recording to come out because I'm going to watch this at least one more time. Thank you so much for your time today. Thank you all for being here to support Athena and IE. Please have a wonderful rest of your week and happy Women's History Month, everybody.
Thank you so much. Thanks everybody for joining. Thanks for having us.
So
Thank you.